the Pet Health and Happiness podcast from Bella and Duke, keeping you at the cutting edge of pet nutrition, behaviour and health with expert interviews, mythbusters and more to help your pet lead a healthier, happier life.
Hi everybody, my name is Rowan Sanderson. I'm the CNO, Chief Nutritional Officer here at Bella and Duke, and in this week's episode we are going to cover everything you need to know about vaccinations with one of our favourite vets, Dr. Brendan Clark of the RFVS. Dr. Brendan Clark, welcome. How are you?
Hi, oh great. Yes, enjoying autumn.
Yes.
The fruits of harvest.
Is it relief from the Yorkshire tropics?
Oh, no, we're having our Indian summer. It's all coming back for a moment. So
Brilliant. Brilliant. There's a rumour out there that you've been collecting hay with your doggos.
Oh, indeed. Making hay while the sun shines. Yeah.
Excellent.
Got my first organic hay in this year, so that's hard fought.
It's progress. So you have food for your animals for the winter.
Indeed, yes. My few goats. I'm starting to build a little home farm, so yes, it's going to be great. But yeah, I think we're going to have a surfeit of hay because there's sort of rather large bales and lots of them and very few goats. So.
Brendan, Pippa and the Holy Goat. Excellent. So without further ado, let's leap into vaccination. This is kind of a hot topic, and we've seen quite regularly in the Facebook group, and this is why we're doing this podcast, to empower people with, the facts so they can make their own decisions about vaccinations. And I mean, let's start right at the beginning. What is a vaccination?
Okay, so a vaccine in the purest form is taking a weakened or killed virus or bacteria that can cause disease and injecting it, exposing yourself, whether by injection or by taking it orally, things like polio and kennel cough are done that way, or nasally, to initiate an immune response which will protect you from the real disease that's out there in the wild.
Perfect. So what we're doing is actually stimulating either your own or your doggo or your cat's immune system. So they've actually got those kind of white blood cell soldiers ready to identify that virus or bacteria. Is that correct?
Yeah, I could get really complicated about this, and there is a number of different ways that the immune system then reacts to that vaccine. One being antibodies, which we'll talk about in a moment, okay? And the other being the cells, the white cells that you call, there's something called CD4, CD8 counts, which is to do with a cellular immunity that can be generated to those as well. They're much harder to read, okay? And so often we concentrate, as we have with coronavirus, on things like antibodies, rather than actually looking at the cellular immunity.
Right. Wow. I can see we might go into some deep rabbit warrens of intel here, but keeping it kind of, shall we say, 1,000 feet for the moment for everybody to jump in. That's what a vaccination is. So you would vaccinate to protect your dog or yourself from potential viruses or bacteria.
Yeah.
Okay. So one of the number one questions is, when is the best time to vaccinate a puppy?
Okay, so a lot of things have been looked at for that over the years. There are some great information pages from the World Small Animal Veterinary Association, the American Veterinary Medical Association, the British Small Animal Veterinary Association on vaccinations and when to give those. The majority will advocate that the later you can give the vaccine, the better.
Okay.
Which is contrary to a lot of people, concerned with, well, I want to cover against parvo, I want to do it really, really early. But let me give you a little timeline for the sake of understanding why we're talking about later vaccination.
Okay.
So When the puppies are born, they will drink a first milk from mum, and that is full, it's called colostrum, and it's full of antibodies. So as long as mum has shown some immunity, they will pass on those antibodies to the puppy, and they're absorbed through the gut at that stage very quickly, and they will last in the puppy's body for about 12 weeks.
Okay.
So therefore you can immediately see there's a 12-week stage that we would be considering as a vaccination.
Tremendous. Well, this is really intriguing. I can see there's more here, Brendan.
There is.
Okay.
So, look, everybody out there will have heard of, well, I can vaccinate my puppy from 5 to 6 weeks. Officially, the data sheet says 6 weeks. A lot of work will be done, and I know you've got a great behaviourist on board, which will talk to you about this, about why vaccinating earlier might establish an ability to get your puppy out sooner so that they can do socialisation events and, you know, get to meet the environment. Please look at some of that information about how you can habituate your puppy, socialise them safely without having to bang them full of vaccine early at that stage. Two issues that may occur. One, the vaccine is taken out by the immune system's antibodies from mum that early. And two, their own immune system may not be mature enough to actually cope and produce antibodies from that vaccine. So there is a debate as to whether it is proper to actually give them vaccines so early in their lifetimes.
Okay, cool. So to summarize this first section is really you should never vaccinate before 6 weeks and ideally leave it as long as possible towards 12 weeks and to try and work around the socialization part alternatively to taking your puppy outside. Is that correct?
Yeah, so there's various bits that can be dealt with there. So optimally, all of the vaccines are licensed, that certainly after 12 weeks, some after 10 weeks, but certainly after 12 weeks, you can give a single shot of 3 of the really important viruses. So that's distemper, parvovirus, and infectious hepatitis or adenovirus at that point, and that will give full immunity for that first year. So they don't need to have 2 shots. So you can minimize the amount of vaccine that they're having if you do that. The second part is leptospirosis. You need 2 parts of that, okay? Really, at least 2 to 5 weeks apart, depending on the particular vaccine.
Okay.
And at that point, you can give those, again, you could give them independently. The later you can give them, the better. So although 12 weeks comes into this as an ideal minimum time to give the vaccine, actually the data from the World Small Animal Veterinary Association really pointed to trying to get the vaccines out as late as even 20 to 24 weeks to be optimal for the puppy's health.
Wow. Now that's a lot later than the majority of advice out there. And I'm sure there are people who are listening saying, okay, well, that's really interesting. And it's all well and good, but we kind of have to live in the real world. And we want to take our puppy out. We want to be able to enjoy our puppy outdoors. So I'm guessing it's a question of toggling optimal for health with optimal for mental health and enjoyment. There's a real balance here to be played.
Absolutely right. And so, you know, that is a decision, an informed choice to make depending on your lifestyle, therefore your puppy's lifestyle, and, you know, the environment you live in and the relative risk of the viruses I've just talked about. And that's why you really need to have a conversation with your vet who's local to you, knows the local environment, and have a discussion about what the relative risks are and, you know, how you can improve the health of your puppy, but also compromise to make sure they're protected.
Okay. And just to recap, or rather to reassert, This is never intended as medical advice. What Brendan and I are attempting to do here is just give you some of the facts and the reason some of these things are said, so that you can have a proper conversation with your vet and you know the questions to ask. So I think the next part of this, Brendan, is, I think we've covered quite a lot. What is a vaccination? Why you would vaccinate? When ideally you vaccinate, and the types of things you would want to vaccinate for. The next question is, what is a titer test?
Okay, so we talked about antibodies earlier, and antibodies can be measured within the bloodstream for these viruses. Now that's really just for distemper, hepatitis and parvovirus. They can be found for leptospirosis, but because of cellular immunity, the antibody levels for lepto don't generally last that long. So we really concentrate on those three viruses: distemper, hepatitis, and parvovirus.
Okay.
Now, in a gold standard, titer test is marvelous because you can be taking that and you can monitor very specifically, not just the amount of antibody, but the strength of that antibody to take out virus, okay? And so you can actually get very accurate counts, which will tell you how immune using antibodies your dog is. And we used to do this for years, okay? From the early 90s, the practice has been doing titer tests, but they are relatively expensive. So they may be in the region of 100 to 120 pounds for a true virus neutralizing titer to be taken. There is an alternative, and that is something called a VacciCheck. And a VacciCheck really was brought about on the back of the information from the WSAVA and BSAVA guidance, suggesting that if you can detect antibodies for those viruses, then pretty much your dog is immune, regardless of the actual strength or quantity. And therefore, you can avoid over-vaccinating by giving, again, vaccines over and over again. Okay? Now,
okay,
that is one of, yeah, I'll let you
Sorry, let's just recap here, because there's a lot of really good information. There's a difference between a titer test and a VacciCheck, and both play an important role. Both can be relevant to any owners out there, any pet guardians who want to decide whether or not to revaccinate. Correct?
That's right.
Okay.
And the advantage of VacciCheck is they're generally done within the practice. Depending on how the practice manages those to keep costs down, they could be anywhere in the region of 25 to 35 pounds on top of your health check. Your health check is a really important, integral part of keeping up with your puppy's health or your dog's health with your vet. And then it's about, do you choose a vaccine or do you choose a VacciCheck in those circumstances? And that's then has some cost implications.
Okay, so the VacciCheck is substantially cheaper than the titer test. And for the sake of practicality, it can do pretty much what we need it to do in terms of informing the owner whether or not another vaccine is required.
Yeah, and I would say, as a practice, this has led to about a 5-fold increase in the number of people looking at the antibody levels within their dogs rather than vaccinating over when we were just doing the actual titer tests to the lab.
So I think it's really important that we just outline a couple of things here, because we've been talking about this off camera, haven't we, Brendan? And a critical part of this is neither pro nor against vaccination. What it is an insight into what vaccines do, so you can decide when and how to vaccinate to ensure your puppy is protected. And I think we're going to dive now into a couple of topics, aren't we, specifically on that. So if people decide they want to choose a vaccine, Brendan, what should they be looking out for?
Okay, so within a vaccine these days, so the ideal is that you would have just the material in a weakened form, if not killed form, that you would expose to the patient and they create an immune response. Unfortunately, it's not that simple. And often things are added to that little vial in order to try and, one, preserve the vial, make sure that the stuff that's inside it is dead or weakened. And those can include materials, things like thimerosal, which is a mercury-based salt, or indeed to aggravate the immune system when that vial has been injected in order to increase the immune response. And those are called adjuvants. And things like aluminium hydroxide, castor oil, all sorts of things like that are sometimes used as those aggravating factors. And those in themselves can actually cause some of the adverse events, the reactions that are seen when you give a vaccine.
Okay, so just to recap, there's two types of things which can go into the vaccine that people should be aware of. One is effectively a preservative or something to kill the vaccine and ensure it remains inert. Is that the correct term? Mm-hmm. And secondly, things to exacerbate the impact on the immune system to create a reaction.
Indeed, those are the sort of two big additives. The rest is really sort of leftovers, if you like, from growing the virus. So many of these are grown on egg or beef protein, so albumin, which if left in the vaccine in large quantities can actually also act as an immune stimulant to the immune system and cause antibodies. So this is one of the reasons why people presume that our increase in certain food allergies can be a problem. And indeed, you know, the rise of peanut allergies, people have questioned whether castor oil has had influence on the level of peanut allergies in young children.
Okay, this is really interesting. So when people are speaking with their vet and seeking medical advice from that vet, what should they be asking them?
So if you look at the vaccines, there are a number of different brands. And so we see various reaction rates in those vaccines. And you should be asking, you know, what are the risks, the adverse events that are happening? So those vets should be able to tell you what's within the vaccine, whether there is aluminium hydroxide, whether there is thimerosal. There are a number of vaccines that actually reduce the proteins and are considered safer in those circumstances where you do have to give vaccines. So have a conversation about what's in the vaccine. If your vet is unsure, ask them to check and maybe not vaccinate at that time, but actually come back when you're confident that the vaccine is the right thing for you to do at that point.
Perfect. Now, there's something very important as well that we need to encourage people to do, isn't there? That you told me about. I had no idea. It makes perfect sense. But if your dog suffers any form of adverse reaction to the vaccine, or even if you suspect so, what should they do, Brendan?
Okay, but this is a really important point. There is nothing so much as a personal experience or experience of a family or friend to put people off vaccination. And we have a reporting rate that's actually been researched to be as low as 4% of actual reactions are reported properly for them to trace through and work out what the actual reaction rates are to vaccines. Currently, they rest at about 15 animals in 10,000 will have a reaction to a vaccine within the UK. And those are the reported rates. That can be raised where you're giving increased numbers of leptospirosis up to about 64 in 10,000, so about a fourfold increase.
Okay.
And so we say to people, please, to be as accurate as possible, there is a great reporting system that the Veterinary Medicine Directorate, which is a government-led body, have put in place where if you suspect, so you don't have to know, if you suspect that your animal has had a reaction following a vaccine, and that could be anything from a skin irritation through to behavioral change, through to even as severe as seizures or cancers or anything like that, or immune-mediated conditions, you can report that through the vmd.gov.uk website for suspect adverse reactions. Okay? It's a really simple form. Preferably, you would ask your vet to fill it in for you. But if you don't think they are, or you're not with the same vet anymore, then please know that anybody can fill that in. The more information you can give on that form, the better, but it doesn't have to be absolutely, to the dot of what the drug was precisely. It just needs to be the brand, the batch number is great if you've got it, the time and date and the age of the dog. Okay, so those are simple things that can be put in there. It's a really great form. It helps the veterinary profession paint a picture of truly what the reaction rates are. So I'd encourage you, don't talk about it on a forum, get onto that reporting form and actually report it, because that way all of your efforts will not go hidden. They will actually be showing us as a profession what the true reaction rates are.
Okay, well, we'd love to help you back this, because everybody needs to know exactly what they're doing and putting into their dog, be it food or otherwise. And we will put links to that in the show notes below. And we will also post that in the Facebook group. As you know, we're on a mission to create the most welcoming and most informed raw feeding Facebook group out there. And frankly, this is what everybody needs to know about. We've been doing this now for 3.5 years, and it's the first time I've heard that there's an active form that people should be filling in. That's great. Thanks for sharing that, Brendan.
Great stuff.
So, okay. Well, I think we've covered quite a lot there. We've covered what a vaccine is, when you may want to consider it, and things to take into consideration on that, the types of things you would vaccinate for, questions to ask your vet specifically about the things that have gone into the vaccine, and tools that will empower you to decide when and how you vaccinate. And I think with this one, because it's such a sensitive topic, we're keen to reassert that this is not medical advice. This is us giving you some points, or rather Dr. Brendan very kindly sharing some of his professional knowledge about engaging with your vet and asking some grown-up informed decisions. Brendan, do we have anything more to add on that one?
No, I think that's a great roundup. Just make an informed choice, make sure it's the right thing for your pets. And if you really need further advice, and you're not sure about a primary opinion, there's nothing wrong with seeking a second opinion out there from another colleague. Yeah.
And once again, please, if your dog has any kind of adverse reaction to a vaccine, notify the vet, and please fill in this governmental form to help other people see what is happening, because things improve when people report it, and we want to make the world a better place. Simple as. On that note, Brendan, thank you so much for joining us. Thank you for sharing once again. People are loving these. If anybody has any further questions, please comment, like the podcast below, and come and join our Facebook group. It would be a pleasure to welcome you, and I look forward to seeing you in the next episode. Brendan, thank you.
A pleasure as always.